Well, good afternoon, and thanks for joining us again for another dialogue with the Dean, bringing you more campus updates. Before we start, as always, if you have questions about any of the things we talk about today, please feel free to comment there in the comment box, and we'll come back and we'll be sure to respond. Well, today it's a pleasure to welcome the Dean of the Purdue College of Veterinary Medicine, Dr. Willie Reed. Willie, thanks for being with me today and to share a little bit about your college as well as some ways that our two colleges have been working together for a number of years. And so thanks for being here.
Well, let me start out, Eric, by saying thank you for the opportunity to visit today and spend some time together. We certainly view the College of Pharmacy as one of our closest partners and collaborators, so thank you for the opportunity.
But yeah, it's our pleasure. So for some of our viewers probably think they know all about the College of Veterinary Medicine, but provide a brief update on your college and some of the things that are going on over in your neck of the woods.
Yeah, I like to think of our college as being among the Purdue colleges, sort of middle age, certainly not as old as pharmacy or agriculture or engineering. So our college started in 1959. It's when we admitted the first class and graduated the first class of doctors of veterinary medicine in 1963. So 63 years old or so, that's the length of our college. So we are one of actually now 33 colleges of veterinary medicine in our country of 330 million people. So the veterinary profession is actually relatively small, with only about 120,000 vets in the entire country. So here at Purdue, our college, in terms of enrollment, we are one of the smaller colleges actually of the 33, and we chose that route because of the fact that so many of the applicants to our college say that they come here because of the relatively small size. So small size meaning the enrollment is 84 students per class. And the veterinary curriculum is a 4-year course of study after undergraduate studies. And the average enrollment of a U.S. veterinary college is about 120 students. And so that gives you a perspective of where we fall. And the largest enrollment is around about 160 students, and the lowest is about 45. So we have about 120 faculty. And so with the four classes of 84, so over 330 students. In addition, we have an undergraduate program actually in veterinary nursing. We have two programs here on campus. One where we offer the BS degree in veterinary nursing, and then we also offer the associate's degree in veterinary nursing. We have an online veterinary nursing program where we offer the associate's degree, and that's actually a program that's growing rapidly. We have about, 500 or 600 students in that program at any given time. The on-campus nursing program is relatively small. We only admit about 30 students per year, and most of them will go on to get their BS degree, even though the entry-level credential for a veterinary nurse is the associate's degree. So in addition, we have three academic departments. Then we have the large veterinary teaching hospital, and then the animal disease diagnostic laboratory, which provides diagnostic assistance to animal owners and veterinarians throughout the state of Indiana. So that's kind of a thumbnail sketch of the college.
Well, pharmacy and vet med have had a long-standing relationship, and through the generosity of a couple of our pharmacy alums, Greg and Kim Wasson, several years ago we set up the Wasson Veterinary Pharmacy Residency Program. So share a little bit with the listeners, viewers, about that residency program.
Yeah. Well, first of all, we are very grateful to the Wassons for starting that program, which is fairly unique. And when we started it 8 years ago, I think it was the first program of its kind located on a campus where there was a College of Pharmacy and a College of Veterinary Medicine. So we're very proud that we were able to do that here at Purdue. Veterinary pharmacy training is relatively rare in this country. There are only 4 programs in the whole country, and of course one being here at Purdue. And this program has been just a treasure, in my opinion, in the college. It has had such an impact. Um, in patient care, for example, is greatly improved. Then we've allowed the pharmacy graduates who have an interest in veterinary pharmacy to continue their education, and they've been able to, after finishing the program, to get some really terrific jobs. So we are seeding many of the veterinary teaching hospitals in this country with Purdue residents, pharmacy residents. And so that's been something that I think has been really impactful for the veterinary profession. And so, we hope that it will continue for many years to come.
It's been great, and to your point, there are just such a small number of programs like this around the country, and such an important area, especially as we continue to see the role of pharmacists and vets expand. And certainly on the pharmacy side of things, the last couple of years during the COVID-19 pandemic, we've seen rapid changes in the pharmacy profession. So maybe explain a little bit about the importance of pharmacists, especially as you see going forward on the animal care team.
Well, I can tell you that the pharmacy residents have become key members of the team. And in our college, we talk a lot about the veterinary team, and usually we're talking about the veterinary nurse and the veterinarian. But now we're really talking about the veterinary pharmacist as well. The residents have had such an impact on patient care, and they're spending about half of their time out in the clinic, in the hospital, where they participate in rounds. They interact with veterinary students, they interact with veterinary nursing students, they review charts for medication issues and recommend maybe changes in dosages of medication. They recommend maybe increasing or decreasing the length of treatment. They have also discovered a number of errors, which are certainly have a big impact on patient safety. They've advised the clinicians on drugs that maybe we didn't consider. And a lot of the drugs that we use are off-label. So having that extra expertise in how to utilize those drugs have been so very important to our hospital and ultimately, of course, our patients.
I would think just dosing alone it can be a challenge, especially as we have newer and newer agents come along, and you have such a variety in the size of patients, from small dogs and cats to livestock. That the pharmacist role can be really important.
That is very important. That is so true, Eric, to have that expertise literally at our fingertips. So it's been great. And I think the pharmacy residents have really enjoyed it because they get a chance as a new pharmacy graduate to work with pharmacists who've had years of experience, which we have we have 3 pharmacists, and then they get a chance to work with veterinarians, and they're learning a whole new skill set that they didn't learn in pharmacy school. They learn all about these veterinary products, and they learn about the laws and regulations governing animal products. Because when you're talking about livestock, for example, withdrawal times, drugs that you can't use in food-producing animals. So acquiring that knowledge, I think, has been very valuable to these residents, and have really allowed them to compete for some really top jobs in this country.
It's one of the things we brag about is our ability to give our students and our trainees, and this would include residents, opportunities to really do a lot of different things across the profession, and I think this veterinary pharmacy space is a great example.
It's a great example because the pharmacy residents, they certainly spend a lot of their time over in the College of Vet Med, but they're over here too in your college, and I believe they teach an elective course in veterinary pharmacy, and they interact with veterinary pharmacy students, and so I think it's been good all around, and I'm just so impressed with not that I'm bragging, but probably I am, about the product that we have produced in 1 year. It's just amazing. And so I can't really thank the Watsons enough for the foresight and wanting to create something as important as this pharmacy program has been.
Well, typically we let our guest ask me a question or two, and so maybe I'll see if you have a.
Well, one of the things that I'm always interested in and have been interested in is interprofessional education. You know, how can your college and my college, the two professional colleges on this campus, work together into interprofessional training of our students, for example, or maybe engaging in some joint One Health programs.
So, so there's those two pieces there. One on the interprofessional side, um, I think we've really got an opportunity to think about ways that our students come together so they appreciate the skill set of the others. And we've certainly seen, I think, over the last decade, more and more interest in particularly companion animal prescriptions coming into community pharmacies. And so I think making sure that our graduates are prepared for that. Compounding, unique veterinary-based compounding. Oftentimes, community vets may need some assistance with certain compounding products that would be appropriate for veterinary use. And so that's really important, I think, on the research side. Again, formulation of products that are used in veterinary uses for animals, and how we might create unique formulations and manufacturing processes. One good example of that we've really been exploring is 3D printing of pharmaceuticals, which gives sort of real-time ability to scale up and scale down a dosage form. And you could imagine that with the right equipment, you could create a dosage form for a small animal, but then pivot over very quickly to scale up to have a dosage form for larger animals. And so 3D printing, I think, has a great opportunity and application in the veterinary pharmacy space. And then I think service learning, as our graduates work together in serving the populations and patients, both the owners and the patients themselves, can be really, really important. So there's great opportunity there as we come to appreciate the unique role each of our professions has to serve the population. Now, you mentioned One Health. For those who don't know, One Health is a CDC program that really, and you can embellish this, but my understanding is really designed for us to think about environments where humans and animals interface, which is in the home, is on farms, and in a lot of different areas. And so how we interface with our animal companions, broadly defined as humans, is really important. So one of those areas that I think is really important, and you sort of made mention of this a little bit, about how the use of drugs in animals. Antibiotic stewardship would be a good example of how we need to think carefully about antibiotic use in animals and in humans, because of the potential for zoonotic diseases that can cross over one way or the other. And so I think that's
well, I really like that a lot, because the judicious use of antibiotics is a huge issue for not just for the veterinary profession, but for all of medicine, right? And so that's actually some good examples of how we could interact.
The other one that I think about too is well-being. We tout pharmacists as probably being the most accessible human healthcare provider, that something like 80% of the population lives within 5 miles or so of a community pharmacy. And so as we think about placing pharmacists in roles in communities that help address well-being, we know that companion animals play a major role in well-being, and this is also part of One Health. And so that it isn't just about clinical medicine and medications about a patient's well-being, but also thinking about how an animal can come alongside and contribute to that overall well-being of human patients is really important.
Well, that's really true. In fact, we have a center in the College of Veterinary Medicine. It's called the Human Animal Bond Center, where we study the relationship of animals to people, and how they impact our lives, how they impact our health, both mental health and physical health. So I really like that as something to explore.
Well, there's great opportunity for us to continue to build out the relationship between our two great colleges, educating our students so that they're really well prepared to support each other as we promote health, human health and animal health together. So thanks for being with me, and thank you all for watching today. Again, if you have suggestions for other topics you'd like to see us cover, please come back and make those recommendations to us. Shoot us an email. Have a wonderful holiday season, and we'll see you next month. Hail Purdue and boiler up.
Well,